Pharmacy Skills Lab Communication Assessment.
Hi there, can I help you?
Hi, I'm here to pick up a prescription.
Okay, and who's it for?
It's for my daughter, Lily Cooper.
Lily Cooper. Oh, it's right here, we just finished it. All right, some amoxicillin. Can you just confirm her birth date so I make sure I have the right person?
Birthday is February 2nd, 2018.
February 2nd, 2018. Okay, so this is an antibiotic. Can you tell me a little bit about what's going on with the infection?
She has an ear infection.
Ear infection, okay.
Yeah.
All right. Like, when did it start? Or?
Oh, she's had it for a couple days.
Yeah.
Yeah.
Okay. Yeah, sorry, I'm just asking you these questions because I want to make sure that, before I give it out to you, that it's going to be the right choice and it's going to work and all that sort of stuff.
Okay.
Is that all right?
Yeah.
Okay. Okay, so she's had it for a couple of days. Does she have any allergies?
No allergies.
Does she take any other medications?
No.
Any, prescription medications or OTCs, herbals?
No.
Nothing like that?
No.
Okay. Let's see. So, is she sick otherwise? Like any illnesses or?
No.
Otherwise, healthy, just this ear infection, hey? That's not bad. Did the doctor tell you how to use this? Like,
No.
No? And you probably haven't used this sort of antibiotic before, have you?
No, she's never had a
Other kids?
prescription before, yeah.
No. Okay. So, this is an antibiotic for the ear infection, so it should hopefully get rid of that infection. You use it twice a day. Did the doctor tell you that? Or?
Nope.
No, twice a day. Okay, so keep it in the fridge because otherwise it won't. It'll expire and won't work for the full 10 days. So you got to keep it in the fridge.
Okay.
Shake it up really well before you give it to her because
Okay.
it kind of settles out, and otherwise you won't get the proper dose.
Okay.
It comes with a little syringe here. So the proper dose is 7 milliliters. So you can kind of see on the side there. Hopefully you can see the 7 there. So you just sort of shake it up and insert this into the liquid and just draw up until the plunger hits 7, kind of like that.
Okay, perfect.
And then you just squirt that in her mouth twice a day, and hopefully she likes it. It's just twice a day, morning and night, for 10 days. So make sure you use it for the full 10 days so it gets rid of the ear infection completely.
Okay.
What else can I tell you? Do you have any questions?
No, I don't think so.
Side effects are usually not a big deal with this antibiotic. It's pretty well tolerated. Every now and then kids have a bit of an upset stomach, maybe some diarrhea. It's pretty rare, so I wouldn't expect that to be a problem. If it does, just maybe give it to her after she eats, so there's some food in her stomach. Yeah, but like I say, it shouldn't be a problem. And a bit of diarrhea usually isn't. Usually, getting rid of the ear infection is more important than diarrhea, so most people don't mind. If something like that happens, it's not too bad.
Okay.
What else? Yeah, so it should work within a couple of days. Like, you should see her getting better within 2 or 3 days, and if she doesn't, that's a good sign. You should take her back to the doctor. Maybe if it's not working for whatever reason, the bacteria is resistant to this antibiotic, you would know within a couple of days. So if 2 or 3 days you don't notice a big improvement, I would take her back or give the doctor a call. Maybe you need something different. Yeah, so I think that's about all I have. Any other questions for me?
None that I can think of.
No? Okay, well, that's it.
Thank you.
Hope she feels better.
Thanks.
The feedback provided in this video is comprehensive. In many situations, it may not be feasible or practical to provide such comprehensive feedback to a learner. Assessors should aim to provide the most comprehensive feedback possible with the time available, focusing on the most important aspects of what went well and what should be improved. Let's take a look at the feedback that would have been provided to this student. Here's what went well for the student. The student had suitable language, pace, and tone for the context. He had a relaxed and personable demeanor. With the exception of using the term OTC, the student used patient-friendly language that the mother seemed to easily understand. His verbal communication was clear and precise. He gave clear and correct instructions on how to store the antibiotic and how to drop the medication into the oral syringe. The student listened to the responses that Lily's mother provided to his questions. He also checked in with the mother at several points in the interaction to ask if she had any questions. The student gathered information effectively through the use of open-ended and closed-ended questions. He used an open-ended question at the beginning of the counsel by asking, "Can you tell me about what is going on with the infection?" And then he used closed-ended questions to gather information that the mother did not initially provide. Here's what could have gone better. The interaction was somewhat disorganized. At the beginning of the counseling session, the student started off by asking the mother questions about Lily's ear infection. When he wasn't really getting much information from her, he then explained his rationale for asking these questions. You might suggest to the student that he introduce to the patient what he is going to cover or ask before doing so that the patient knows what to expect. The interaction seemed a little disorganized at times, and it ended awkwardly or abruptly. Use of intentional transition statements and summary statements to move the counseling session along would have been useful. At times, the student's nonverbal cues were not suitable for the context. This was demonstrated when the student spoke to Lily's mom and provided information to her while looking away from her and down at his paper. Although students are not discouraged from using their notes during counseling sessions to assist them in the lab, it is important that this does not distract from the interaction. Feedback to the student could be that the eye contact that he made with the client was appropriate, but rather than continuing to talk while looking down at his paper, it would have been more effective to finish your point to the patient, then briefly check your notes before breaking from the interaction. Little effort was made by the student to demonstrate empathy. Although he told Lily's mom that he hopes Lily feels better, it didn't really feel genuine, and he tended to downplay the infection, stating, "So just an ear infection? That's not that bad," as well as the potential adverse effects as being no big deal. As I mentioned, he came across as relaxed during this interaction, but perhaps too relaxed at times. As an assessor, you may suggest to him to think about ways in which he could convey empathy in his interactions with patients during his counseling sessions to better engage with the patient. The student used frequent ums and uhs, which were distracted and did not convey confidence. Bottom line, the way in which the student conveyed information to the patient's mom was clear and concise, but this lack of empathy and coming across as being fairly disengaged from the interaction may leave Lily's mom feeling as though the student was disinterested. This may prevent her from approaching the pharmacist with any questions she may have about this prescription or any other future prescriptions for her child. With all this in mind, the student was given a grade of G, or growing.